Today we have with us Dr. Jeevan, consulting physician diabetologist from Bangalore. Doctor will be sharing some important tips on how we can manage diabetes effectively and maintain a healthy lifestyle. Doctor, what is diabetes and why is it becoming so common today?
Diabetes, any blood sugar level more than 140 milligrams per deciliter in the fasting and more than 180 to 160 milligrams per deciliter in postprandial, we call it as diabetes. Just because of the unhealthy habits and sedentary lifestyles, I would like to prefer to say sedentary lifestyle and lack of exercise is the most common important thing. And stress is the second most common thing. Type 1 diabetes, which is autoimmune diabetes, quite commonly seen, which was rare a decade or 2 decades ago. But in this generation, we are very commonly encountering this diabetes.
Doctor, can diabetes really affect people who look fit and healthy?
We can't assess the patient by looking at them, whether they are fit or healthy. Definitely, it will affect you. Most of the people will be fit and healthy. They feel themselves as fit and healthy without any symptoms, because diabetes is asymptomatic until and unless they affect from any of the problems, any of the complications. Commonly, patients will suffer from weight loss, polyphagia, polydipsia. That could be the quite common, very early symptoms, I would like to say. Most of the people are encountering of diabetes, even though they look fit and healthy. Screening of the blood sugar is very much important, I would like to say.
Doctor, what are the early signs that someone might be diabetic?
Early signs of diabetes mainly is the weight loss, the lethargy. There is a common symptoms, non-healing ulcer, delayed healing of the ulcers or wound. What we could assess signs we could pick up is again certainly the loss of weight and easy fatigueness and loss of wasting of the muscles. These are the common signs we could pick up, and also the loss of appetite will be there. These are the early signs and symptoms where most of the newly diagnosed diabetes comes out. These signs and symptoms bring them to the clinic or hospital.
Doctor, why is it important to test your blood sugar regularly even if you feel fine?
See, in diabetes, most of the people will be asymptomatic until he or she suffers from some of the complications. So once the sugars are more for a long period of time, the complications are quite commonly affected. Most commonly is neuropathy, or if at all, if it's not neuropathy or nephropathy or unhealing ulcer. Once patient goes to ketoacidosis, it's quite difficult to manage in the OPD setup. Patient has to be admitted in ICU setup. So to prevent these complications, frequent monitoring of blood sugar is very much important.
Doctor, how does uncontrolled diabetes affect other parts of the body?
Diabetes, if it is not controlled, definitely it affects most of the major organs in the body. We classify it as the microvascular complications and macrovascular complications. Diabetic neuropathy, first and foremost complications, followed by diabetic retinopathy, diabetic nephropathy, or kidneys will be involved, and your eyes, retina will be involved. Definitely patient might lose their vision, might lose their functions of the kidney. The filtration capacity will be lost, creatinine will be increased. Definitely he or she might land up in complications such as dialysis. So to prevent these complications, frequent blood sugar monitoring is very much required.
That was Dr. Jeevan, guiding us with valuable insights on diabetes management. Stay aware, stay healthy, and let's take a step towards a diabetes-free future. This message was issued in public interest by IPCA Laboratories.